few alternative disinfection processes and equipment that is out there on the market that in some instances is very effective, but at the same time can be very costly for a facility depending on your size to take on. A couple of these are missing machines. These are generally electrostatic machines, meaning that they charge the chemical when it touches a surface so that it covers the full surface area of a chemical. These machines can cost somewhere between $1,500 and $2,000 and generally require specific chemicals that were manufactured and designed specifically for use with the machine. You've probably all heard of UV light disinfection. This is a process of using UVC specific light to break down or disinfect for microorganisms on a surface. These have several safety concerns and can be harmful for humans if you're running the machine in a room and someone enters the room while the machine is running, and can cause skin damage in that way. They also are only effective in cleaning what they see or what the light touches. So anything, any microorganism that is in an area cast by the shadow of the machine, it will not disinfect that surface necessarily. For these machines especially, they're extremely costly. They can be between $10,000 to $20,000 a piece for the proper UVC disinfecting systems. Another system is fogging or misting. Here at Dartmouth-Hitchcock, we have a high-level disinfection process that uses hydrogen peroxide vapor and is really meant for healthcare settings that are meant to target specific pathogens like known pathogens in an environment like COVID-19 or Clostridium difficile. Again, these systems are also very expensive and generally come with a service contract requiring ongoing servicing to run those machines and also take specialized training. It also is key to know that although they are they have effectiveness in their specific uses, they do not replace standard cleaning and disinfection as you go into the spaces that you're cleaning. For instance, if you do not remove visible soiling, these will not disinfect what is underneath of that soiling, and you could potentially still have contamination issues. The big question that I get a lot when it comes to cleaning is how often do we clean what items? And what I would say is it's not always easy to determine what the best frequency for cleaning a surface may be. For high use or high touch areas, cleaning should be increased, especially right now, in a way to make sure that we're not building up soil or microorganisms. I would say if a surface is soiled or becomes visibly soiled, that is probably the best time to clean and disinfect it. But I would leave it to your best judgment to determine what the best time frame for cleaning a surface is. For instance, high touch areas, like I said, cash register counters, those may need to be wiped down between every customer. But something that you don't touch on a regular basis, like the top portion of a wall or a ceiling, you may not need to clean it as often. And consider what spaces you're using. That's always important to understand. What I will say is cleaning and disinfecting is going to clean a surface for a short period of time, but contamination begins as soon as the surface has been cleaned. So consistently disinfecting a surface all the time is not always realistic. So what I would tell you is between cleaning and disinfecting, consider using hand hygiene techniques like an alcohol-based hand sanitizer or soap and water between cleanings so that you're preventing cross-contamination from other surfaces. Wearing gloves universally is something that a lot of people think is necessary, but it doesn't help keep surfaces clean that are already clean. It can actually lead to additional cross-contamination from other surfaces that have contamination. I want to talk a little bit, I've talked a lot about surfaces and materials, and I want to touch a little bit about what those mean and how they're handled from a cleaning perspective. Many surfaces and materials are handled the same, but they all have their different needs and considerations. For surfaces, there really are two categories of surfaces. You have your hard surfaces or non-porous surfaces. These are generally a surface that has some sort of finish on top, like tile or countertops that are made of a composite material. They generally have a sealed surface. Those are the easiest to clean because you're going to use the standard disinfection process following the dwell time and other manufacturing specifications for the cleaning chemical that you're using. For soft surfaces or porous surfaces, we're talking about things like exposed wood for picnic tables or fabric upholstery on furniture. These are generally hard to disinfect, but you can spot disinfect areas that you know have had bodily fluid, such as urine or blood that come in contact with them, and disinfect them that way. Generally speaking, washing them with a mild detergent or soap and water is always the best way to try to keep fabric surfaces clean on upholstered furniture. But always be careful with things like bleach. As everyone's probably aware, bleach can leave staining on non-porous surfaces when they're clean. And then always be careful with things like electronics. Electronics are definitely something that is hard to keep clean and can often be damaged if you put too much liquid on them. For materials, things like linen, curtains, and other fabric items that are non-porous, regular laundering is important, and you should increase the frequency of doing the laundering when you can. For things like books, paper items, and periodicals, papers from schools, it's obviously not recommended that you put a liquid disinfectant. It will destroy those materials. So time is generally the best disinfectant. The American Library Association has recommended that at least a 24-hour segregation period be maintained for these items before you put them back into circulation or try to handle them further from when you receive them. You can, however, use a disinfecting product to wipe down the outside dust covers or plastic coverings that are generally put on books. Also keep into consideration delicate or historical items. You want to be careful because they are fragile and sometimes old. What I would recommend is looking in the link that I've provided on the last slide. The National Center for Preservation Technology and Training, which is a part of the National Park Service, has put together a really good webinar tutorial on how to clean those more fragile items that you may have. Finally, I want to talk about how you can either reopen or continue to operate your facility as you go. You want to take time to do it the right way so that you can stay open and open safely and be able to keep your facility clean. Now, it seems like that could be a large undertaking, but it's really as easy as 1, 2, 3. The CDC has put together this 3-step process to plan for, implement, and maintain cleaning in your facility using tools and guidance that are that we've laid out and talked about, and easily get your facility ready to open. We do have a few specific considerations to keep in mind as you start to build your plan. From a cleaning perspective, especially if your facility has been closed, there are a couple things to keep in mind. Things to look for, like mold and dust. They tend to build up on surfaces when they haven't been cleaned or dusted regularly. Who else has moved in since you've moved out? In a lot of instances, pests will move into your area, like mice, that will create their own issues with cleaning. So it's always good to try to talk to a pest management service or think about pest management principles as you go. Another thing, is your refrigerator clean? You may have closed in a hurry. You may not have been able to get everything out of your refrigerator. So it may be a good time to go through your refrigerator. You'll know if it's not clean because you'll smell it before you see it. And it's always good to think about what you have in your facility. If you keep it in your facility when you open, it's going to need to be cleaned. So I would recommend removing things that don't necessarily need to be there and may make the time frame a little bit longer for cleaning. And then a few facilities things to keep in mind. For air system considerations, before you turn things on like air handling systems or air conditioning units, it's always important to think about increasing the air circulation. If you have an air handling system, getting it maintenance before you turn it on and having it run with a higher circulation rate is always a good thing to do to remove all of the stale and old air and any microorganisms that may be in the air as you move forward. Always think to clean or change your air filters in those systems, including the window, your window AC units, which many have filters, to make sure that you're not taking dust or mold that may be captured and blowing that back into your facility. And if you need to, always consider calling an HVAC service provider to have them come look at your system. From a water and plumbing perspective, things to think about are your water lines. Making sure that if you have potable water in your facility, that you've run the water systems and you've cleared all of those sinks. You want to make sure that that water runs and that it goes down your drain so that drink and or sink and toilet traps refill. Those generally, if they're empty, will create septic smells that will come up through your sink and could be an issue. And always look for leaks or weeping joints. If you have a plumber, it's always good to have them on hand to help you look at those things to make sure everything is taken care of properly. And the last thing I'll say about plumbing is hot water tanks. You want to make sure that if you haven't run your hot water in a long time, that you drain and refill the tank to prevent things like Legionella from forming. And generally make sure that your thermostat is set to 120 degrees or higher to make sure initially that you kill any Legionella that may be in the facility. And again, always keep your plumber on standby. If you run your water and you have a leak, it's always great to have an expert standing by to stop that leak from turning into a major flood. So with that, I want to say thank you to everybody for having me. I know that this seems like a lot of information, but it is intended to keep you in a sense of preparedness as you try to open your business, so you can keep it open for a long period and not have to close because of cleaning-related considerations. Like I said before, I've also compiled a pretty extensive resource list here in the presentation, and I've also worked to upload several handouts and brochures that can be that are posted that will go with the slides here that have a little bit more in-depth information about a lot of these topics. So with that, that's the end of my presentation. Again, thank you all, and happy to answer any questions.
That's great, Zach. Thank you so much. A huge amount of information in a very short time. We do have a number of questions, and I just want to remind people to please introduce yourselves by name and workplace. And a reminder that we will be posting the slides because that was a lot to take in at one time. Thank you. We have a question from Lynn about an N-list for dummies. Lynn, a great question. Do you want to pose it?
Yeah, I looked at the N-list a month and a half ago, and I just found it really very confusing. I don't understand the jargon. I'm a librarian. I'm not a chemist or anyone who handles these chemicals on a regular basis. We hire out the cleaning. But just to guarantee that we all are doing the best possible service to our libraries and our communities, we want to make sure we're doing it right. So is there some place where you can summarize, or there's a summary of the different types of chemicals, brands that we should be looking at? I know everybody's talking about Lysol and you know, the hand sanitizers has to be 60% alcohol, but beyond that, that end list is endless and confusing for most of us.
Yeah, it's a very comprehensive list. It's got thousands of different chemicals from everything I've talked about. I think the big thing is to look at the label on the chemical itself. Generally, the manufacturer's label, especially on retail products, will have the information there, and it'll also have a helpline for whatever that manufacturer is. And it really depends. I've looked at things from Lysol disinfecting wipes that are on the end list and have a 10-minute dwell time, which is a long time to try to keep a surface wet to disinfect, to things like Clorox wipes, which are much less when it comes to Clorox bleach wipes. So I think it's mainly important to think about the type of chemical. So is it a bleach-based chemical or is it ammonia-based quaternary disinfectant? So there are a lot of factors, and I know it can sometimes be confusing, but if you have a chemical and you're not sure, definitely call the manufacturer.
It sounds like an opportunity for somebody to put together sort of a short, very clear list for non-professionals in this area. Just saying. There's a similar question. Beth Narbonne had a question about training in industrial disinfectants. Beth, do you want to unmute and ask that question?
Yeah, sure. Hi, everyone. I work at the Rochester Public Library, and we have a lot of staff who are going to have to be doing the in-between patron switching out workstation high-touch cleaning. And we have a full-time custodian, which is great, but there are also times when she's not in our building, and it's a big building. So I was wondering if there was any training available, preferably virtually, of course, that you could recommend for staff who have no experience in doing any sort of, like professional cleaning as opposed to the cleaning we were used to doing.
So I think I would start by pointing you to the CDC website on cleaning. It's in the resource links. They have a lot of really good guidance for training. I think one of the things that I would suggest is talk with your custodian as well to help to run a hands-on training with folks. And then again, a lot of manufacturing sales representatives and janitorial chemical distribution company sales representatives are really highly trained in training to that. Take that with a grain of salt. They are sales reps, and they're going to try to sell you on their chemicals. So if you have a specific company that you're working with, I would reach out to those representatives to help do some of that training as well.
Thank you.
Thanks very much. Thanks to everyone.